Hello guys, welcome back to my channel, welcome back to my YouTube channel. Thanks for watching my video. I'm really happy that you clicked on this video and you are watching this video. And this video is going to be about choices, different choices, what we can make, especially nurses, or especially if you're just finishing from a nursing school, or you're just finishing your nursing degree and you are confused on the type of specialty you want to do. Now I'm going to be listing 20 different best nursing specialties for you that you can actually go to. These specialties are very lovely and they are always in demand in nursing. Now make sure you watch this video to the end, and don't forget to subscribe to my channel, leave your comment, give me a thumbs up. Now let's go through this video together. So the first nursing specialty I would like to talk about is the critical care nurse. Critical care nursing is one of the best nursing career specialty that you can actually do. I know critical care nursing is a nursing field that defines itself by the hospital unit in which they work. I know critical care nurses help patients in critical care floors, and majorly critical care nurses work in intensive care units, or sometimes some of them work in trauma centers. And unlike other nursing specialties, critical nurses are always they are always needed everywhere everywhere you go. Now, critical nurses, for you to become a critical care nurse, you actually have some years of experience working as a critical care nurse, and you also have to do some learning education, probably enroll in an intensive care nursing school. For me, I'm a critical care nurse. I'm working in an intensive care unit. So critical care nursing is one of the best specialty in nursing I'm going to recommend. Now the next one is pediatric nursing. Pediatric nursing is also a very good specialty in nursing, and it's also related to neonatal nursing. It's quite similar, but neonatal nursing is also a professional. They are professional nurses that assist patients as they give birth and directly afterwards. So this neonatal nurses focuses on mothers. They work hand in hand with the nurse midwives after delivery of baby and also before delivery. So most of these nurses work in the labor and delivery units, or sometimes they work also in a postpartum unit. They also monitor both the mothers and the babies. So this is the specialties of the neonatal nurses. And majorly they also work in the neonatal intensive care units, which is called the NICU, where newborn babies who are premature or ill can receive continuous care. So these are what the neonatal nurses do. Now the next nursing specialty I'll be talking about is nurse midwife. They are also called the midwives. Their name already speaks for them. This is an advanced practice nurse, and majorly they work with a pregnant woman during pregnancy, during delivery, and sometimes they also still work with the mom post delivery. And they are always they are always in high demand in nursing all the time. You always need a nurse midwife anywhere or anytime you go. So nurse midwife or going for a midwifery course is not bad if you actually have a passion in babies or in care for babies and all that. Nurse midwife can be a very good course, or can be a good course that you can take up. Clinical nurse is the next specialty I'll talk about. Clinical nurse, this is they are under the umbrella of the practice nurses with different specialties. Now they can be orthopedic nurses. They are all, it's like a big umbrella, and they are sometimes called to oversee clinical floors to ensure that all nurses use the best practice. Unlike other nursing careers at this level, the clinical nurse specialists professionals do not need prescription privileges in order to practice. Most of them can be able to prescribe medications and all that. Now the nursing specialty I'll talk about is dialysis nurse. This is also called a renal nurse, renal/dialysis nurse. Renal nurses deal with patients suffering from kidney failure, and they deal with patients that requires regular dialysis to clean their blood. So they are always professionals in working with a dialysis machine, and this process requires the attention of specialized nurses. I know dialysis nurses assesses the patient before each procedure, that before they start the dialysis, and they also ensure safety during the process, and also they perform assessment when the dialysis is complete. So what they do majorly is care during dialysis, pre-dialysis, and post-dialysis. Now, the next nurse specialty I'll talk about is nurse anaesthetist. They are also called the anesthetic nurse or the nurse anaesthetist. You know that these types of nurses, they work in the theater during surgery or during trauma. Mostly, for you to become a nurse anesthetist, you have to go for some advanced courses, and most times nurse anesthetists administer topical or regional or general anesthesia as needed, and also they enjoy the same prescription like physicians. They are also able to carry out some procedures like the doctors, and nurse anesthetists can also, I can say it is one of the highest paying nursing specialties. So if you actually want money, you can go for nurse anesthetist. You can go become a nurse anesthetist, and if you like to work in the theater but probably don't want to become a theater nurse, you can actually go for nurse anesthetist. It's a very, very lovely nursing specialty. Now, the next nursing specialty, which is the eighth one I will talk about, is the theater nurses. They are also called the OR nurses, or the operating room nurses. Theater nurses work with the doctors during surgical procedures. They don't really deal with they are quite different from the nurse anesthetist, because the nurse anesthetist deals with medication and anesthesia, while operating room nurses deals with everything in the operating room. They deal with the patient. They try to give the patient reassurance before the surgery and during the surgery, after the surgery. They are also called perioperative nurses, because everything relating to the patient for the surgery, for a patient that wants to do a surgery, everything related to the patient for the surgery, the theater nurses are the ones that will actually look after this patient before the surgery, during the surgery, and after the surgery. Now, the eighth clinical nursing specialty I'll talk about is a clinical nurse educator. Now, if you like teaching like me, I think I like teaching. If you like teaching, or if you actually you don't really want to practice, you don't want to do bedside nursing, you can actually become a clinical nurse educator. You can be a nurse educator, you can work in the university, you can be a lecturer. Clinical nurse educator is one of the very good nursing specialty. If you like giving out information, if you have the passion to teach and to tell people the latest development of what is happening. The next nursing specialty I'll talk about is nursing advocate. I think this is one of the new clinical nursing specialty that is coming on. This type of nurses, they work between the patient and the medical team. Now, they ensure high levels of care and intervene on behalf of the patient whenever a problem arises. So this type of nurses, they work in between the patient and the multidisciplinary teams. The nurse advocates for the patient, for these specialized professionals exclusively they do this work, and most times the nurses typically work in the hospitals or outpatient surgery centers. They also advocate for patients that don't have adequate mental capacity. They are not able to make decisions on their own. The next nursing specialty I'll talk about is nurse researchers. Presently now, a lot of research is going on in the health line, and nurse researchers are one of the specialties that is now highly needed. They conduct studies and analyze data to to innovate in healthcare. So these nurse researchers, they work for hospitals, research laboratories, clinics, or pharmaceutical companies. These nurses typically, they research topics that can affect nursing, such as to make it safer, but they don't carry out bedside nursing tasks. So these are the nurse researchers. Now the next clinic of specialty I'll talk about is pain management nurse. Pain management nurses they assist and treat patients suffering from chronic or acute pain. Now, with an estimated millions of people living in pain with chronic pains, this is one of the most demand nursing jobs in almost everywhere. Now, pain specialty nurses, they actually have their normal RN and their BSN, and they specialize in pain nursing, and most of the time they have to be registered under the American Society of Pain Management Nursing. So it is also a very good nursing specialty if you really love to treat pain and you don't like your patients to go through pain. Now, let's talk about psychiatric nursing. Psychiatric nursing is very, very good nursing specialties that we all know, and these nurses, they assist patients with mental illness, and they work in hospitals, and sometimes they also work in inpatient care facilities to ensure that the patients take their medications, they stay safe from harm, and they also attend to counseling section. They can also work with patients who have Alzheimer's or dementia, either through in the home care settings or in the hospital setting. So most of these nurses, they work directly with patients that require mental health care. They work directly with patients that has mental illness. The next nursing specialty is trauma nurses. Trauma nurses, they are also called, they are also known as the emergency nurses or the accident and emergency nurses. This type of nurses, they work in trauma units of the hospital or the emergency unit, and the patients recover from physical traumas, including serious injuries from accidents. Then these trauma nurses are the ones that become advanced and practice nurses. Sometimes some of them can become nurse practitioners within these specialties. Next nursing specialty let's talk about is travel nurses. Travel nurses this is a title that implies to nurses that travels from one place to another, depending on the need of their employer. Now, they travel between hospitals, clinics, between private hospitals or public hospitals, and also they practice in outpatient centers to fill staffing needs. So these are like temporary. They don't really have a permanent place to go to every day. They move from one center to another center. They travel a lot. So these nurses travel. They just travel a lot from one place. And these nurses can also specialize in any specific practice or be available to work in any role. So they are ready to work in any role, and they can actually practice anywhere they want to. Now, the next one I'll talk about is geriatric nursing. Geriatric nurses are also called old people's nurse because they deal with old people, and they deal with geriatrics. People are old geriatric nurse. Geriatric nursing is one of the most in-demand nursing jobs, and geriatric nurses, they work in hospitals and skilled nursing facilities to care for patients in the golden years of their lives, and they are skilled in their areas of memory care and end-of-life nursing, dementia, and all that. So this is like the peculiarities of geriatric nursing. If you like to be among you like to staying with old people, geriatric nurses might be one of the things you would like to go for, and it is actually a very good nursing specialty that you can go. Now let's talk about public health nursing. Public health nursing is a very good nursing specialty because it's also it is in high demand at the moment. And this nursing specialties, they look after the communities. They are also called like district nurses or community nurses, and they are employed, most time they are employed by government agencies or sometimes by the hospitals to design and implement health campaigns, and also health campaigns that can impact the surrounding areas or specific populations. And most times the public health nurses also, they are the one that provide immunization in the communities, provide health talk. Their main aim is on prevention of infection and diseases. They work in the primary health care setting. So this is the public health nurse. This is their role. Now the next one I'm going to talk about is the oncology nursing. Oncology nurses, as we all know, oncology, these are cancer nurses. They actually deal with patients that has cancer, and they deal with patients who need to receive cancer treatment, and these professionals assist with inpatient care, and for those who stay in the hospitals or outpatient treatments such as chemotherapy. And also they tend to work for hospital, but most times they assist the medical practitioners in attending the patient that needs probably chemotherapy, radiotherapy, brachytherapy. Apparently just cancer treatment nurses. These are nurses that deal with cancer patients. And to become an oncology nurse, it's just for you to have your RN, register as a nurse, and also go for your specialty in that field of nursing. So these are the specialty nurses I would talk about. I'm sure there are other more specialties in nursing, but these are the ones I've been able to pick that I've seen are very relevant, and it's something that is very good that I can recommend for anyone, anybody. I'm sure you should be able to pick one nursing specialty that you actually love from all what I've actually said above. Alright guys, thank you for watching my video. I'll be seeing you in my next video, and don't forget, this is Ruth. I'm a nurse blogger. I vlog on nursing, health, fitness and lifestyle. Don't forget to subscribe to my channel and give me a thumbs up, share this video, like it, comment, and I'll be seeing you in my next video guys. Alright, see you later in my next video. Bye family.